And a wonderful good day to you. This is Owen McCafferty speaking on behalf of the Kindness of Professional Fusion to provide ideas and thoughts for you in the advancement of your professional activities in practice. Today I'd like to talk about image and how you project that image. And this is directed at everybody in practice. The way you are perceived in the first 10 seconds of an introduction is the way that you will be remembered for a long time to come. It's going to take a lot of work to change that initial impression. That's why image, which is sounding somewhat plasticky, is so important. You have to dress the part. If you're a professional and you're seeing patients at an average transaction rate of 150 an hour, that means, and you're seeing patients at four times in an hour, that means you're charging $600 an hour. Now, when you engage somebody at $600 an hour, you would expect, number one, that you'll want to see a tie on them. That's a lot of money. Secondly, they should be able to be groomed, bathed, and they have to carry an air of confidence and a willingness to listen and understand the commentary with a servant's heart, not of a dictator-based heart. So image in the initial stages in the exam room become so important. Eye contact is a crucial element. If you can't look somebody in the eye, they can't be trusted. A firm handshake establishes confidence. Not too firm, that could be aggression. So you want to be able to project right from the start that you're a nice person and they want to be with you on a long-term basis. And you also have to project that you really do know what you're doing. Don't make a declarative statement with a lisp up that makes it sound like a question. Speak the difference between declarative sentences, interrogative sentences, interrogatory sentences, exclamations. Know the difference in how you communicate. But image becomes an important part. So I talked about the tie for guys. Obviously, that's a factor. But in most medical professions, you may be coming into the examination room in a lab coat. You may be coming into the examination room in some sort of smock. A surgical smock with blood is not good. It's a look that you really don't want to have. You want to act in a professional manner. I can think, for example, I go to Mayo Clinic here in beautiful Jacksonville, Florida, and the attending doctors in their consultation always wear suits and ties. I'm not saying just sports coats, they're wearing suits and ties. They project competency. And Mayo Clinic is not a cheap place to go, but the adage is kind of like going to Disney World. If you have to ask the price, you're in the wrong place. So dressing and projecting an infinitely confident image, but not overbearing, having a servant's heart, dressing appropriately. And the last part, I received this idea, not from myself, but from one of the people that I follow on YouTube. Her name is Megan Bentley. And I think she's the color countess. But basically, Megan will allow you to see what best coloring would be available by draping certain colors and making a determination of what season you're in. I'd strongly encourage you, if you haven't done it already, to consider doing something like that. And then when it comes time to select your clothes, you know exactly what you should be wearing. But it goes far further than that. I also had, unfortunately, this image reminded to me when I was watching, again, another YouTube of some of the folks from Ireland in the county that my family is from, Mayo. Great people, wonderful information, very creative souls. But sometimes their language is a little rough, and that's their culture. They use words that their cousins here in America would never even dream of using. But they do it as a matter of course. And it becomes part of their linguistic repertoire. That's not the case over here. Try to use the King's English. Try to make sure that when you talk with someone, you're speaking clearly, distinctly, at a volume level that they can understand. Whisperers and mumblers need not apply. You want to make sure that the client, in that short time that you're with them, or the patient, whatever case your profession would be, that they are understanding what you're saying, that they have confidence, that the cadence with which you speak is comprehensible, and it's the type of person that you want to spend time with. So that's enough said. This is Owen McCafferty. I sure want to say thank you and hope to talk to you at some time in the future.